Hello. Today I'm answering the question, what should you do when you have had a baby and your breasts are not full or your milk has not come in? This is very important because what you do in those initial days lay the foundation of whether you'll be able to successfully breastfeed or not. And we know that we recommend that when you have a baby, you do exclusive breastfeeding. That is breast milk alone, no added food, no added water until the baby is 6 months old. And even beyond that, you do continued breastfeeding. We also know that breastfeeding is the most important intervention that has made a difference in the survival of our newborns. So what you do in the initial days after delivery, very, very important. Those days as well, the baby is so vulnerable to infections, to jaundice, to low blood sugars, to being cold, so many things. So those initial days are so important that it is very important to us that you get it right for the sake of your baby. So when you deliver initially, it takes a few days for your breast to become full with milk, or what we call the milk coming in. But this is a wrong term because there's already some milk, even though your breast is not full. But it will take a few days for your breast to be full. So don't be surprised if you deliver and your breast is not full. Sometimes you are so surprised that it makes you anxious and you think that you may not be able to breastfeed. No, that is how it is. Very rarely do you have a baby and within the first 2 days or so, your breast gets full. Initially, it is not full. It may take about 3 to 5 days for your breast to get full with milk, or as we wrongly say it, for your milk to come in. When you deliver, the first milk that you have is called the colostrum. It's so small. Sometimes the whole amount is about 10 mils, which is very small. It's less than a tablespoon. But you know what? That colostrum is so rich. It is so rich in proteins, and it has all these things that help your baby to fight infections. It also protects your baby against newborn jaundice because it helps them to go to toilets. So that colostrum is very important. But your baby will not get the colostrum unless you put the baby to the breast. So when you deliver, whether you have the feeling that your breast is full of milk or not, you should put your baby to the breast, because when you do so, your baby will get colostrum. Your baby's stomach is very small. It doesn't need a lot to fill it at that stage. The stomach grows as the baby grows. Even the colostrum will help the digestive system, including the intestines, to develop well. So when you deliver, even if you don't think you have any milk, put your baby to the breast. Apart from colostrum, which protects your baby from infections, allergies, jaundice, and keeps your baby full, the other reason why you should put your baby to the breast is this. The body only produces a lot of breast milk when the body senses that there is somebody that needs this breast milk. And the best way for the body to sense this is if a baby is sucking on the breast. So what I'm saying is that if you don't put your baby to the breast, your breast will get full later than if you begin immediately to put your baby to the breast. Put your baby to the breast, whether you have the feeling that there is milk in your breast or not, because the act of putting your baby to the breast will help your body to produce more breast milk. So that's the other thing for you to note. Now, we said that when a baby sucks on your breast, then the body senses it, and then your milk production increases fast, right? So what happens when, because you feel that you don't have milk in your breast, you give other feeds to your baby? We call those pre-lacteal feeds, or feeds that you give before you establish breastfeeding. What happens is that it diminishes the ability of your baby to suck on your breast, because you've given the baby food. And the baby may be full. Once the baby is full, the baby is not going to suck on your breast. And once there is no baby sucking on your breast, it takes a longer time before you produce breast milk. It takes a longer time during which the baby is at risk of infection, at risk of jaundice, at risk of dehydration before the milk comes in. This does not only apply to food like formula, it also applies to dextrose water that we may give the babies because of the perception that there is no milk in your breast. Once you do this, you diminish the baby's hunger. You diminish the ability of your baby to suck on your breast for the milk to come in early. So are there times when you should worry? Of course, when it's about day 3 and nothing at all is coming in your breast, that is if you have expressed well and you realize that nothing is coming, because the expression also has a technique. Or the baby's sugar gets low, when the healthcare workers are worried, they check the baby's sugar and it's low. Of course, then something else should be done for the baby. But this actually is rare. What you should do, in addition to putting your baby to the breast, is to hold your baby. We know that when you put your baby skin to skin, that is, your baby's skin is in contact with your skin, it helps for your milk to come in faster, or your breast to get full faster, so that you can establish breastfeeding faster. So while you put your baby to the breast, in between, hold your baby's skin to skin. It even helps your baby's sugar to be stable. Your baby may not be breastfeeding a lot, but it helps for the sugar to be stable so that the baby does not get low sugars or hypoglycemia and will need other feeds or dextrose water to be given to your baby. So keep putting the baby to the breast and then hold the baby skin to skin. I talked about why you should not give prelacteal feeds to your baby, right? Because that will make the breast to get full later than it would ordinarily. The other reason you should not do that is because these feeds can be contaminated and you are putting your baby at risk. Breast milk is not contaminated if it's coming straight from the breast. Another reason is that when you do this, if you use a bottle to feed the baby may get what we call nipple confusion, and when that happens, it becomes more difficult for the baby to latch onto your breast appropriately, and you need the baby to latch onto your breast appropriately to help you to breastfeed in a manner that does not cause pain to you, because then your nipples will not get cracked, and then you are also not anxious. Once the baby latches appropriately, it helps the baby to remove milk well, it sends the right signals, and then you produce a lot more breast milk, and you're not anxious that, oh, you've had a baby and then you are not getting breast milk for your baby. So what I'm saying is that if you have had a baby and you feel that your breasts are not full, or you even feel that there is no milk in the breast, what you should do is to continue to put your baby to the breast. There is no rush to introduce other foods to the baby or to introduce dextrose water unless you are told by the healthcare workers that the baby's sugar is low. Even that one, what you should do is hold the baby's skin to skin. It helps to stabilize the blood sugar. But of course, there will be cases still when the baby's blood sugar is low. But do not be in a hurry to feed other things to the baby. And don't worry if your milk does not come in, or your breast do not get full the first day you deliver or the second day. It can take a few days. It can take about 2, 3, 4 days for your breast to really get full with milk. Thank you for watching this video, and please subscribe if you haven't done so. You should visit our blog. When you are there, consider joining the parenting club. It's free. What we do is that every week we reach you via email and offer you personalized guidance. Personalized because it is according to the age of your child. And there we talk about everything that has to do with the health of your baby or your child. Bye.